Hello students, in our earlier session we studied absorption and distribution of drug under ADME. In this session we'll go through metabolism and excretion processes for drug under ADME. Elimination. Elimination is an irreversible process of removal of drug from the body. It occurs by means of two processes, metabolism and excretion. Metabolism, also known as biotransformation, is a process of breaking down of complex molecules into simpler forms for easy elimination. The main organs responsible for biotransformation are liver, kidney, intestine, lung, and plasma. There are three major approaches for drug metabolism. First, either inactivation of drug to an inactive or a less active form. Second, breakdown of an active metabolite to form active drugs. In some cases, it could be a toxic or a mutagen. Third, activation of a prodrug to form a active drug. Drug metabolism can occur in organ level, cellular level, and biochemical level. In organ level, it occurs in organs like lung, kidney, intestine, skin, and placenta. At cellular level, it involves a lot of enzymes in the smooth endoplasmic reticulum. At biochemical level, it can be divided into two phases depending upon the type of reactions that occur. Phase 1, which involves oxidation reduction reactions, and phase 2 involving conjugation reaction. The drug metabolism involves many enzymes which are involved in either oxidation, reduction, conjugation, or hydrolysis reactions. The table here summarizes phase 1 and phase 2 reactions that occur for drug metabolism in liver. In certain cases, certain drug metabolites become inactive due to spontaneous molecular rearrangement rather than breakdown. No enzymes are involved in this reaction. This is referred to as Hofmann elimination. Liver is an important site for drug metabolism. Here, after the phase 1 and phase 2 reactions, the conjugated drugs could follow two paths or ways. Either first, directly pass into the kidneys through the blood and get eliminated. The other option is to get excreted into the bile, move to the intestine, undergo deconjugation by the bacterial flora in the intestine, and reabsorbed. This is again transported to the liver via the portal system and undergoes another round of conjugations and biliary excretion, as shown in the adjacent figure. This process is known as enterohepatic cycling. I had mentioned this phenomena while explaining first pass clearance in my earlier session. The figure here summarizes the enterohepatic cycling. Certain oral drug substances get metabolized in the intestinal mucosa by the action of enzymes like esterase, lipase, and glucuronidase. Metabolism of drug leads to one of the following phenomena. First, inactivation of a drug metabolite and increase in the solubility of the drug metabolite in water to accelerate elimination. Second, activation of prodrugs to make it into active forms. Third, formation of active metabolites with similar or novel activity. In some cases, it could also be a toxic or a mutagenic substance. Detoxification of toxic xenobiotics, toxification of non-toxic xenobiotics. The next process after metabolism is excretion of the drug from the body. It involves all the processes for removing drug from the body either in unchanged or in a biotransformed form. Kidneys are a major organ or site for excretion. Other than that, certain non-renal sites are lungs, biliary systems, intestine, salivary glands, and skin for excretion of drug products or metabolites. Excretion process in the kidney involves the glomerular filtration, tubular secretion, and tubular reabsorption. Since you are familiar with these processes, I would not go into detail. The main extraction route is by means of urine and bile. Other than that, there are some other forms of excretion, that is through lungs, milk, saliva, hair, semen, tears. The figure on the adjacent shows the different ways of excretion of drug products. Clearance. Clearance is an index to predict the rate of elimination in relation to the drug concentration. It is defined as the volume of blood cleared of drug per unit time. It is obtained by the formula rate of elimination divided by concentration, which could be with respect to the blood, plasma, or unbound forms in water. Elimination of a drug in the body involves kidney, lung, liver, and other organs. The total body clearance or systemic clearance of drug is sum total of each that happen in the kidney, liver, and other organs involved, as shown in the equations adjacent. The clearance of drug from the body is calculated with respect to volume of blood. It is the blood cleared from drug per unit time. This, in most of the cases, is independent of the concentration or the dose. However, the rate of elimination of drug depends on the concentration of the dosage. Elimination rate of the drug is the amount of drug cleared from the blood per unit time. The value may differ from the clearance value in case of first order reactions. The clearance in that case can be calculated from the dose divided by the area under the curve. The significance of clearance is to calculate the dose to maintain the dosage concentration in the plasma. Another important index to be measured is the half-life of the drug. It is the time required to eliminate or excrete half the concentration of the drug. It depends upon the volume of distribution and the clearance value. The figure on the right shows the AUC for a drug. The peak at which the drug is at maximum in the blood plasma, that is after absorption, and the minimum value of the concentration of blood, that is after excretion. The half-life of the drug comes between these two parameters. The figure here showcases the absorption, distribution, and elimination of a drug based upon its administration route. To maintain the therapeutic index of a drug, the concentration of drug should be maintained in the body. This is done by administering a definite dosage of the drug at regular intervals. This is referred to as maintenance dose. In case of drugs which have 100% bioavailability, as in case of IV route of administration, the dose rate should be equal to the rate of elimination of the drug. Whereas in case of oral doses where the bioavailability is less than 100%, there the dosing rate oral should be the ratio of dosing rate to the bioavailability of the oral dose. In such cases, the maintenance dose is calculated as a product of dosage rate and dosing interval. Loading dose. Any drug to show its effect should reach a steady concentration. In certain drugs with longer half-life, it is achieved after a very long time. To overcome this and to achieve a minimum effective concentration, the first dose administered to the subject is of higher concentration, followed by the maintenance dose later at regular intervals. The initial or the first dose in such case is known as the loading dose, and it is a product of maintenance dose and accumulation factor. The graph here shows and explains the minimum effective drug plasma concentration with and without a loading dose. Dose ratio. The ratio of the loading dose to the maintenance dose is called as the dose ratio. To maintain a regular steady concentration of the drug in the body when the maintenance dose is given at regular intervals, it leads to accumulation of some amount of drug in the body. The measure of this index is known as the accumulation factor. The accumulation of a drug up to a steady state occurs when the drug intake is equal to the drug eliminated. A proper calculation of the drug dosage at regular intervals of time can be calculated, and if done properly, the plasma level of the drug can be maintained between the maximum and minimum effective levels. The time course of drug action. The time course of drug action combines the principle of pharmacokinetics and pharmacodynamics. The effect of the drug can be immediate, delayed, or a cumulative action. The figure here summarizes the ADME process. A look into of the points to remember under ADME. First, absorption, its sites of absorption and factors affecting absorption. What is bioavailability? Second, under distribution, what is distribution? The sites where distribution occurs, factors affecting distribution, the barriers and drug reservoirs. What is apparent volume of distribution? Under metabolism, the sites of metabolism and the different types of reaction that occurs under metabolism to break down complex molecules into simpler molecules for elimination. Next, under excretion, the major sites of excretion, what are the different clearance values with definition, the first pass, and certain terminologies like half-life, threshold value, maintenance dose, loading dose, drug accumulation, and therapeutic dose.
Thank you.